Hello parents. So I'm here to talk a few things about diarrhea today. So I want you to remember three things in diarrhea. One is vaccinate your child with rotaviral vaccines. Second is regarding ORS. Third is regarding zinc, and fourth is regarding diet. So the first thing is rotaviral vaccine. Why it is so important? Because around 60% of all the diarrheal cases are viral. Among the viruses, it is rotavirus which is most common and causes a very bad dehydration, which is difficult to correct without admission. Second thing is ORS. Now diarrhea, whatsoever the cause is, there are two standard treatment that goes. One is ORS, second one is zinc. Now why am I stressing so much on ORS? Parents come to me with just any Tetra pack, say ORSL, which are not actual ORS drinks at all. In fact, they have written that it is not ORS. So when you're looking for ORS sachets or ORS Tetra packs, make sure that the label of WHO standardized ORS is labeled on it. Now, this WHO standardized ORS replaces the electrolytes exactly as much as needed according to the loss in the loose stool. One more thing is this WHO standardized ORS is not age specific. It is the same ORS that is used in pediatrics as well as adults. So make sure you always purchase this. There are two sachets, one of 200 ml, another sachet to be mixed in 1 liter. Once mixed, you can keep in room temperature for around 24 hours. How do you replace the stool losses? For each loose stool, you have to replace around 10 ml per kg of your baby's body weight. Say your baby is 5 kg, you will have to replace around 50 ml for each loose stool. And that's how you remember how much to give after each loose stool. So the second thing is zinc. Now zinc, when your pediatrician or a doctor gives, you have to give it for complete 2 weeks or 14 days. Do not stop zinc once the diarrhea stops. Say the diarrhea stops in 5 days, and I've seen many parents, they stop off the zinc. The purpose why zinc is given is it reduces the chances of your child having diarrhea in the next 3 months as well. The main action being the reparative process that happens in the GIT is boosted by zinc. So the repair process is faster, the amount of water in the stool is less, plus the chances of having future diarrheal infection in the next 3 months is also reduced with zinc. So make sure that you give the zinc supplement for complete 14 days. Third thing is the diet. So what things you shouldn't give to a child during diarrhea is sugary drinks, extra sweet drinks, just the Glucon-D shouldn't be given to a child with diarrhea. Breastfeeding should be continued, shouldn't be stopped. You make sure that you keep feeding the child, whether with a curd rice, mashed potato, mashed banana in milk, but make sure anything is fine, any homemade food is fine, but make sure that you keep feeding the child. Why is it so important? Because I've seen many parents keeping them almost nil per oral. So keep feeding them. More you feed, the more enzymes are replaced in the gastrointestinal tract, and more easily the diarrhea gets into control. So this is about the diet. Post diarrhea, what care has to be taken? Following an episode of diarrhea after recovery, make sure that your child gets one extra meal. Now this one extra meal compensates for the duration of nutrient loss during the diarrhea. Plus your child would have lost good amount of weight because of the dehydration and stuff. One extra meal for at least 14 days, preferably nutrient dense foods. What do I mean by nutrient dense food? Little food but rich in nutrients, like mashed bananas, mashed potatoes, khichdi with some amount of ghee on it. All these should be given for all the babies following the episode of diarrhea. And make sure you follow hand hygiene practices. Wash the baby's hand and your hand before feeding, after feeding, before cleaning the genital areas, and after cleaning the genital areas. Stay safe, take care.